am Dr. Suvendu Maji and I am here in Neotia Mediplus. I have been attached with Neotia Mediplus previously and now I am seeing patients here regularly. So today I will talk about a very important topic that is about blood cancer, which has been rising slowly and slowly over the time in India. So do you know that the incidence of blood cancer is rising so much so that every 5 minutes one person or one child is being diagnosed with blood cancer somewhere in India or abroad. And you would be astonished to know that the incidence of blood cancer is not less than other cancers, other solid cancers. So blood cancer is a kind of liquid cancer, and around 70 to 80,000 new cancer cases are being diagnosed all over India annually. Now blood cancer can affect not only children but it can affect adults. And let us today know a little bit more about blood cancer, because there is no way other than awareness to prevent or to detect this disease early. So blood cancer is the commonest cancer among the children, and among the children leukemia happens to be the most common cancer. This blood cancer is also common in adults, but different varieties of blood cancers are common in adults. So if I talk about blood cancer, it is a kind of liquid cancer. When you keep it on the if you can differentiate, then you will ask what is solid cancer. So any other cancers which affect our solid organs of body is called solid cancers, whereas liquid cancers are actually which affects what we are talking about now is the blood cancer. Now blood cancer has got various varieties. So 3 different varieties which you might know are leukemia, which is more common in children. The acute leukemias are common in children, whereas it's another variety, chronic leukemias are more common in elderly individuals. In middle-aged groups, say belonging to 35 to 45, 55, lymphoma is another kind of blood cancer which arises from the lymph nodes in our body, which helps us to protect or drain infections present in the blood. Lymphoma is common within the middle-aged group, while elderly individuals are more prone to develop another kind of blood cancer you might know about. It is called multiple myeloma. So different age groups, different types of cancers, but all are different varieties of blood cancers. So now what causes blood cancer? Blood cancer as such, we do not know what actually causes blood cancer, but there are certain risk factors which has been shown constantly to be associated with blood cancers. For example, in children where leukemia is common, the commonest risk factor that is cited is maternal exposure or pre-pregnancy exposure of the mothers to X-rays or chemotherapies or toxic agents or pesticides. So all these are speculative agents. All these are agents which have been constantly shown to have associations that lead to blood cancer in children. In children, blood cancers can run in families also, and there are certain genetic conditions. For example, one common genetic conditions like Down syndrome is associated with ALL or acute lymphoblastic leukemia. Similarly, the other group of cancers, type of blood cancers like lymphoma and multiple myeloma, which happens in adults, have certain known risk factors, like those who work in petroleum industry, those who work with dye industries like aniline dye industry, those who work in automobile industry where exposure to the lead is very common, or those who work with pesticides or those who sprays pesticides. So these are some of the causative agents which can contribute to blood cancer in our late adulthood. Also, there are certain viruses which are known to cause blood cancer. For example, one such virus is HTLV1 or human T cell virus, which is also known to cause some kind of cancers, blood cancer, specific blood cancers, specifically in children. Now, what are the symptoms? How do you identify blood cancer? So, blood cancer can happen at any age, starting from the children or to the in the adults. The commonest symptom is if you feel too tired, or if you get tired easily, that is tiredness or easy fatigability, or if you get an injury and there is easy bruising, the part where you get injured it becomes black, the blood, there is bleeding in the joints, bleeding in the gums. If you go and brush your teeth, if there is easy bleeding, frequent bleeding from your gums which is not due to any other dental causes, or if there is gum hypertrophy, so bone pain, joint swelling, easy bruising, fatigability, tiredness, or low levels of hemoglobin, which in medical terms we call anemia. All these are almost telltale signs and symptoms of blood cancer. Also, if you have a palpable lump in your body, for example, which could be due to a highly or massively enlarged spleen or a massively enlarged liver, that is hepatosplenomegaly, if you have, that can also be a symptom of blood cancer. Also, if you lose, if there is generalized weakness or you lose interest in your normal day-to-day work, that is also an important sign. Also, if you are having these symptoms repeatedly and other chronic illnesses which contribute to similar symptoms can be excluded, then probably these are the red flag signals which tells that might be you can have a blood cancer. Now, how can you diagnose this blood cancer? So, if you have any of these risk factors, if you have any of the symptoms, go to your general physician, go to your family physician or doctor, and just get a simple blood test done. That blood test may tell you there is abnormal amount of hemoglobin or abnormal amount of WBC count which happens in leukemia, or your hemoglobins can also come down also. Then there are two tests. For example, if you are suspected to be a case of blood cancer, then you might have to get a bone marrow biopsy done. Bone marrow biopsy means the bone marrow material needs to be taken out and examined under the microscope. In most cases, this is diagnostic, and once the diagnosis is done, then the treatment begins. The treatment in most cases consists of chemotherapy or bone marrow transplantation at later stage, or in some cases like in lymphoma, radiation can also be done. The role of surgery is very less. The role of surgery only is for diagnostic biopsies. But let me tell you, in most cases, if treatment is done early, if the symptoms are recognized early, if the disease can be caught early, survival can greatly improve. So friends, my dear friends, any one of you, if you have such symptoms, do consult your physician or do consult me. Here I am ready to help you out. Thank you and have a good day.